All right, today we're not just opening a textbook, we're profiling a lineup of some of microbiology's most wanted criminals. These are the gram-negative oddballs, the ones you might not run into every day, but you absolutely have to know for your boards. So let's start the investigation.
And I get it. It's a fair question. You're spending all this time cramming the big names, like E. coli and Pseudomonas. So why should you waste precious brain space on these weird, less common bugs? Well, it all comes down to test-taking strategy.
Because these guys, these oddballs, are perfect for exam questions. They have these weirdly specific growth needs, super strong links to certain exposures like an animal bite or a food, and they come with classic buzzwords that just scream their name. If you know these unique features, they're basically free points on exam day.
Okay, let's meet our first crew. We're calling them the animal and environmental crew. As you can guess, these are the perps you pick up from your pets or maybe a trip to the beach. And our first suspect is Bartonella henselae. Now, when you see this name, your brain should immediately think of one animal in particular. Let's look at its rap sheet. The classic clue, of course, is cat scratch disease. In immunocompromised folks, it can cause something scarier called bacillary angiomatosis. But the real high-yield, tricky clue is its link to culture-negative endocarditis. And what's its MO? Well, it's an intracellular bug, meaning it literally hides inside our cells. That's why you can't just find it easily. You need a special tool, the Werthin starry silver stain, to spot it. All right, next up in the lineup, Pasteurella multicida. This one is all about a really common clinical scenario that gets nasty fast. This phrase right here, this is pure gold. If you see a question about an animal bite, cat, dog, doesn't matter, that turns into a really angry, painful skin infection super quickly, your number one suspect has got to be Pasteurella. It's a classic rock-solid association. Now here's a little trap that exam writers love to set. In the lab, Pasteurella can kind of look like Haemophilus. But here is the key difference you have to know. Pasteurella is easygoing. It'll grow on regular agar. Haemophilus, on the other hand, is a total diva. It's got demands. It requires special X and or V factors to grow. Don't get them mixed up. Our next character is a real celebrity, an A-lister in the world of scary bacteria, the agent of the plague itself, Yersinia pestis. Now, thankfully, it's super rare, but you better believe it's a board exam classic. So what are its telltale signs? Two things. First, under the microscope, it has this unmistakable bipolar staining that looks just like a closed safety pin. It's so unique. And second, its temperature preference is a little weird. Most human pathogens love our body temp, 37 degrees Celsius. Not Yersinia. It actually prefers it a bit cooler, growing best between 25 and 30 degrees. And rounding out this crew is Vibrio vulnificus. This is a special shout out to anyone who loves raw oysters or a nice day at the beach. You gotta know about this one. So the story is almost always one of two things: eating raw oysters or getting a cut exposed to seawater. And what makes this bug so important to know is that it can cause a terrifyingly fast and deadly sepsis, especially in people who already have liver disease. And why the ocean link? It's halophilic, which is just a fancy science word for salt-loving. Okay, let's bring in our next group of suspects. These are the finicky growers. Think of them as the high-maintenance divas of the micro world. They don't make it easy on the lab.
And you absolutely cannot talk about finicky growers without knowing the HASEC group. This is one of those acronyms you just have to burn into your brain. Haemophilus, Aggregatibacterium, Cardiobacterium, Eikenella, and Kingella.
So what brings this gang together? Well, for one, they all normally live in our mouths. They're also capnophilic, meaning they love a CO2-rich environment to grow. But their main calling card is that they grow very slowly. And that's their clinical signature, making them a top cause of that slow, sneaky, culture-negative endocarditis we keep talking about. Next up is another fussy one. And this one's a huge cause of bacterial gastroenteritis. I'm talking about Campylobacter jejuni. Let's break down Campy's profile. It's got a few dead giveaways in the lab. It has this distinct curved shape, often called seagull wings. It's a thermophile, meaning it likes it hot. It grows at 42 degrees Celsius. It's also microaerophilic, so it likes a little oxygen, but not too much. And if you see it moving, it has this classic darting motility. Clinically, sure, it causes bloody diarrhea. But the ultimate must-know high-yield fact is its link to Guillain-Barré syndrome. You have to know that connection. And now for our final group,
the deceivers and specialists. These perps will either try to fool you by looking like something else, or they have a very specific type of victim they go after. First, let's meet the great deceiver, Moraxella catarrhalis. On a gram stain, it shows up as a gram-negative diplococcus, so your brain immediately screams Neisseria, but it has a tell.
And this is it. This is one of the best buzzwords in all of microbiology. Moraxella colonies are so solid, you can literally take a loop and push the entire colony across the agar plate like a tiny hockey puck. It's an unforgettable giveaway that it is absolutely not Neisseria. And now for our specialist. This is Burkholderia cepacia complex. This organism is a major villain for one specific patient population. And that population is patients with cystic fibrosis. So listen up, this is absolutely crucial for your exams. If you see a question about a really bad lung infection in a CF patient, yeah, you think Pseudomonas, but you must also have Burkholderia on your radar. And to make things even worse, it's famous for being multi-drug resistant, making it a total nightmare to treat.
Okay, we've met the whole lineup. Now it's time to lock it all in with a final lightning-fast review. We're going to connect the clue directly to the culprit. Ready?
You see animal bite wound, you think Pasteurella.
You see cat scratch, your suspect is Bartonella.
You say raw oysters or seawater, that screams Vibrio vulnificus.
You see CF sputum, you have to remember Burkholderia.
You see slow, culture-negative endocarditis, that's the MO of the whole HASSIC group.
And finally, you see that darting motility that is classic Campylobacter. So after all that, which buzzword is going to stick in your head forever? Is it the hockey puck colony? The safety pin stain? Maybe the seagull wings? Nailing down these weird, unique features is exactly how you're going to crack the case on exam day. You're ready to identify microbiology's most wanted.